Good morning. My name is Deb Thul. I am the Adolescent Transition Program Coordinator at Alberta Children's Hospital. And my presentation today is going to be on transitioning youth to adult healthcare. Due to advances in medicine, there's a growing number of children with health conditions who are living to adulthood. As such, transition is a relatively new concern and something that those of us who work in healthcare are still trying to learn to do better. However, there are two things that families who've transitioned to adult healthcare have told me that are important. Number one is knowing what to expect when your child turns 18. And number two is preparing for the changes that lie ahead. So that's what this session is all about. The objectives of this session will be to discuss the differences between pediatric and adult healthcare. We will also talk about how to prepare for the transition from pediatric to adult healthcare. And then I will introduce some resources and tools that will be helpful for you as you are preparing. When I say transition, people usually think of the transfer of care, the actual move from pediatric to the adult healthcare system. However, what I mean by transition is a process that holistically addresses the needs of youth as they become young adults. For a seamless transition from pediatric to adult care, we need to consider all aspects of the teen's life, not just their medical needs, but the psychosocial, educational, and vocational needs as well. And transition is a process that happens over time. As youth and their families prepare for the transfer of care, that's the first step. The second step is the actual move to adult healthcare. And then when young adults and their families adjust to the changes, that's the final stage of transition. So for me, transition is a three-step process: the preparation, the actual move, and then the adjustment to the move. The preparation phase of transitioning to adulthood is really all about teaching your teen to do those things that you've been doing for them for years and working towards whatever level of independence that your teen or young adult is going to be able to achieve. This is true of all children as they transition to adulthood because they need to learn the skills like money management, cooking, cleaning, laundry. But for children with ongoing health conditions, this also means learning about their medical condition, learning how to manage their medical condition, learning how to manage their medications and their treatment plan, learning how to talk to doctors and make medical decisions. Leaving Alberta Children's Hospital and moving to an adult clinic is just one part of the transition process. It's important for youth and their families to be preparing for this moment much earlier. Teaching children to be independent adults and do things for themselves is something that we as parents do from the time that they're born. This is also true when it comes to medical independence. We may even be able to start teaching our children about their health condition and how to manage it from the time they're diagnosed, depending on their capacity and their age at diagnosis. This slide shows some of the things that families can be thinking about or doing long before the child turns 18. Some of them you can start at 12, 13, 14 years of age, and some you won't be able to do until 6 to 12 months before your teen's 18th birthday. However, it's always good to know what to do and when to do it, especially if you're going to need to apply for adult decision-making supports or funding for your child. Parents are truly the most important part of their child's transition team. As parents, you know your child best, and you're the best resource to help the pediatric as well as the adult team know what works for your child. Equipping yourself with knowledge about what adult programs and services are out there and what the parameters or eligibility criteria are for them will help you prepare for what lies ahead, and it will make that transition to adulthood easier. Knowledge is power. If your teen is going to continue to be dependent on you throughout their adult life, advocating and speaking up for what they need will be even more critical in the adult years than it was in childhood. Funding and resources are often reduced in adult services, so parents may need to regularly speak up and advocate for their young adult to ensure that their needs are being met. You are also the best resource for helping your young adult reach whatever level of independence they're going to be able to achieve. Over the next 4 or 5 slides, we're going to look at some of the things that teens will need to know and do to work towards medical independence. The first thing that you can do is educate your child about their medical condition using words that they understand. It's really the first step and something that many parents do from the time of diagnosis. Helping your child understand their condition and their treatment plan so that they can explain it to others is going to be an important skill for them to have as they transition to adulthood. If you need resources to help you with this, the Family and Community Resource Center at the Alberta Children's Hospital, which many people refer to as the hospital library, offers books that are written at your child's reading level, information prescriptions, and a very knowledgeable librarian or health information specialist who can help you find the resources that you need to be able to teach your child about their medical condition. This slide also has some URLs for some other good resources and sources of information. The first two, the CCHA4life.org and the iHeartChange.com, are specific to cardiology patients. The other two are more generic resources. The second thing that parents can do is to teach their child how to manage their health. Start by explaining to them information from the medical appointments after you've attended them. Help them set up a routine to remember to take their medications. Teach them how to fill and refill prescriptions. This is often something that gets overlooked because we think our children know how to do this. But many times we need to walk them through that process in small, manageable steps. You'll also want to teach them about the tests that they might need to have and the names and doses of their medication. Explain to them early on not only what they're taking and the amounts that they're taking, but why they need to take the medications or have the tests that they need to have. And explain the risks of not adhering to their treatment plan. Help them understand the implications of their health condition and the current treatments on both their present health and their future health. In addition to teaching your child how to manage their health, you're also going to need to ensure that there are others who understand your child's healthcare needs, so that in the event that you're not available, there's someone who can step in to help care for and manage your child's condition. As they get older, it's important for teens and young adults to be more involved in discussions about their healthcare, whether they're going to be able to make all their own healthcare decisions or not. Encouraging them to ask questions if they don't understand something. And it's a good practice to have them write down their questions ahead of time so that they don't forget to ask them at an appointment. This slide also outlines a small step approach that you can use for helping your teen or young adult become more comfortable with talking to doctors and meeting with them on their own. It also provides some URLs for good websites with information about speaking up and talking to doctors. Learning how to talk to doctors about your health condition and why you are at the appointment that you're at is a very important skill. Sick Kids teaches youth a 3-sentence health summary, and research has shown that physicians respond more positively to youth and young adults who go to their healthcare appointments prepared with this 3-sentence health summary. The 3-sentence health summary is: first sentence, age, diagnosis, and a brief medical history. Second sentence is about the current treatment plan. And the third sentence is related to the question, concern, or the reason for that healthcare appointment or visit. So the example that Sick Children uses on their 3-sentence health summary bookmark is related to asthma. So my name is Deb Thul. I'm 16, obviously not, but I will, for this example, be 16. I'm 16 and I have asthma, and I've been hospitalized twice, but not in the last 5 years. My current treatment plan is I've been taking Ventolin, a flow vent, since I was 3. I'm here today because I cannot run anymore. I wheeze too much and I cannot breathe. Many families start to use that 3-sentence health summary with their child as they're driving to the medical appointment. They start to prepare them to talk to their doctors so that they can use it with their pediatric providers and then become more comfortable creating one on their own when they go to meet with the adult healthcare team. Your child's health record has all the information that healthcare providers need about previous medications, test results, treatments, and more. However, the new adult clinic may have a difficult time finding all the background information they need if it's interspersed throughout your child's chart. As such, they may look to you or your child for the information, the background information that they're missing or that they need. For this reason, it's really important to be keeping track of your child's health information. Some families received a family journal when their child was diagnosed, and they use it or something like it to track their child's appointments, their surgeries, their tests, the test results, medications, treatment plans. If you haven't been keeping track of important health information, you may want to request a copy from health records so that you have some detailed history about your child's health condition, their courses of treatment over the years, etc. This will be important, especially if the adult healthcare provider asks you about dates of surgeries, what they had, previous medications that your child was on and how useful they were, or what was discontinued because of side effects. So you can request. The number on the screen is the number to the Health Records Department at Alberta Children's Hospital, and you can contact them to request a copy of your child's health record. However, it is important to note that you can only request a copy of your child's health record until they are 18 years of age. And if there's confidential information in that health record that your child has requested be kept confidential, when you get a copy of the record, that information could be blacked out. After your child turns 18, you have to have legal guardianship in order to make a request to access your child's health information. And then the third important point about accessing or requesting a copy of health information is that there is a fee for this service. It's also important to keep track of where your child's care is going to be transferred as an adult. On the slide, you will see the words Pediatric Transfer Plan. That's a document that we created here at the Alberta Children's Hospital for patients and families to use to keep track, especially if you're going to more than one clinic or you're going to be seeing different specialists at different places. In addition to keeping track of their health information, where their care is going to be transitioned, it's also really good for your teen and your child and young adult to carry a summary of their medical condition in the event of emergency. Wearing a medical alert or having an in case of an emergency app on your phone are really good options for this. Another thing you're going to need to do to prepare for the move to adult healthcare is to find a family doctor, especially if your child is only seeing pediatric providers right now. Families cannot assume that their doctor is going to accept their child as a patient when they turn 18 if they haven't been providing care for them to that point. Ask your family doctor now, because if they say no, it'll give you time to ask the pediatrician if they know of anyone who's accepting patients, or family and friends if their doctor is accepting patients, or if they know of any doctors who are accepting patients. There are other resources, but I always suggest talking to people that you know first to see if they are aware of someone who is accepting patients. But if you have no results from talking to family and friends, There's a Find a Doctor website that you can see the URL to on this slide. You can phone HealthLink at 811. They keep a list of family doctors who are accepting patients. There is an Elbow River Healing Lodge that offers primary care for Indigenous families. And there's a family care clinic in East Calgary, if you live in that catchment area, that offers a medical home for patients with complex medical needs. Their eligibility criteria is rather rigid because they only accept patients with complex needs who do not have a family doctor. Because they also, in this clinic, provide access to other healthcare professionals like dietitians and social workers, physiotherapists, mental health professionals, nurse practitioners, case managers, etc. The family care clinic is located at 4715 8th Avenue Southeast, and Elbow River Healing Lodge is located at Sheldon Schumer Health Center downtown. Now that we've talked about some of the things that you need to do to prepare your child for medical independence, we're going to turn our attention to some of the differences between pediatric and adult care, things that are helpful to know so that you know what to expect. Sometimes pediatric clinics will treat your child when they have a sore throat or a cold, just because you're in the clinic with them that day. However, adult clinics usually only see your child for concerns directly related to their area of specialty, and they won't treat other conditions, even if you happen to be there that day, and it would be much easier to just see that doctor rather than make an appointment with your family doctor. A family doctor, however, is the hub in adult healthcare. Family doctors receive all the medical information from the specialists that are involved. They're responsible for referrals to all new specialists if your child or young adult requires a referral to someone else. And they coordinate all your medical care. As such, finding a family doctor is critical, as I said in the previous slide. Another thing to know about adult healthcare is that it's not a one-stop shop like it is in the children's hospital. If your child is seeing several different specialists, they may all be at different locations. You might have a specialist at Peter Lougheed, one at the Foothills, one downtown at the Sheldon Schumer Health Center, one at the Old Children's Richmond Road Diagnostic Treatment Center. There are outpatient clinics located at all the adult acute care sites, as well as some other healthcare centers in the Calgary area. So you can't expect that you will be able to see everyone at one place at one time, like we often do here at Alberta Children's. Another thing to know is that you're going to be responsible for following up if you miss appointments. Most adult clinics don't phone if you miss an appointment or follow up the way some pediatric clinics do. Sometimes the first clinic visit to the adult site is arranged for you, but it's important to check with both the pediatric and adult healthcare team to be sure you know what is expected of you. The adult healthcare system often expects youth to be independent and autonomous if they don't have a legal guardian. The adult healthcare system will expect your child to make their own medical decisions, sign their own medical treatment forms. If your child is not able to do that, if your child does not have capacity to make their own medical decisions and sign their own treatment forms, you will need to apply for guardianship. And that's something that we're going to talk about later in the presentation, because it's a very important thing for those young adults who are going to continue to need decision-making support. It's going to take time to develop a rapport and a strong working relationship with the new adult team. Remember, you've had many years with the pediatric team. They may have been involved with your child since birth. They have probably traveled some very difficult roads with you because they were there from the time your child was first diagnosed. They were there for all those hospital visits in the early days. And it's going to take time for you to build a relationship with the new adult team like you had with the pediatric team. Many families tell me that that is one of the hardest things for them about transitioning to a new team, new healthcare team, is that loss of relationships with the old team and a lack of relationship with new teams. You will need to build a relationship with that new adult team. It's going to take time, but the key to building a good relationship with your child's new doctor and healthcare team is open communication and reasonable expectations. Letting the new team know that you trust them and you desire to work with them to support your child's health goes a long way. Another common experience is that adult clinics are busier and adult specialists have a lot more patients. At Alberta Children's Hospital, we only see patients 0 to 18. In the adult healthcare system, they see patients from 18 to 100. This is why it's important to schedule regular visits well in advance. It is highly unlikely that the adult clinic will be able to fit you in on a short notice, unless, of course, your child is ill. Sometimes it takes several months to get an appointment. So ensure that you are connecting with them early on to book appointments for just your regular follow-up visits so that you can have those visits in a timely manner. The other thing that is very common is that clinic visits are shorter in the adult healthcare system. And this is important because many people are taking time off work to go to medical appointments. They don't want to spend a long period of time at the clinic. So the shorter time frame is really designed to accommodate the needs of adults. However, when you first move to adult healthcare, if you're used to long wait times and longer clinic appointments, you're going to have some adjustment. Some of the things that you can do to help you prepare for this is to go to healthcare appointments as prepared as possible. This means whether you're advocating for your child or they're advocating for themselves, someone needs to take charge of the care and know as much as possible about the condition, the treatment plan, and the options. It also means being ready to share specifics and details about any questions or concerns you may have, and being focused during the clinic visit by eliminating distractions like cell phones. This is why writing things down in advance is a really good way to prepare for medical appointments. Write down all the details, all the specifics, all the questions that you have, and the details about your concerns so that you can get them answered in a short and timely way. Another thing that you can do to adjust to the shorter appointment time is to make sure that you arrive on time. And if you're going to be unavoidably late, the roads are bad that day or whatever, let the office know and give them at least 24 hours notice of a canceled appointment. When your child turns 18, Alberta law assumes that they have capacity to make independent decisions. The presumption of capacity remains intact until the contrary is demonstrated. So that means a capacity assessment needs to be done to determine that your child is not able to make their own decisions if they're going to need decision-making support. The Alberta Adult Guardianship and Trusteeship Act offers options for those who want or need decision-making support when they turn 18. There are different types of decision-making support through the Adult Guardianship and Trusteeship Act. The first one is the supported decision-making. This option is for those who have the capacity to make their own decisions but want support. This can apply to many 18, 19, 20-year-olds who continue to want the support of their parents, even though they have capacity to make their own decisions. All that's involved in having a supported decision maker is downloading a supported decision-making form from the Guardianship and Trusteeship website and completing it and authorizing whoever the young adult wants to appoint as their supported decision maker. It's a legal document, but it doesn't require a court process. The next two options are related to personal decisions and are for those who have limited or no capacity to make their own decisions. Co-decision making, for example, is for those who have the capacity to make their own decisions if they have support. They don't have capacity to make decisions on their own, but if they have support, they do. Guardianship, on the other hand, is for those who lack the capacity to make their own decisions. Both of these require a capacity assessment report. For co-decision making, it's a Form 3. For guardianship, it's a Form 4, but they're both called capacity assessment reports. And they would need to be completed by a psychologist, a capacity assessor, a physician, a psychiatrist, and used in a court process to apply to be someone's co-decision maker or someone's guardian. Both co-decision making and guardianship are related to personal decisions. And I'm going to show you on the next slide what personal decisions entail. Trusteeship, on the other hand, is for those who cannot make their own financial decisions, who don't have the capacity to make financial decisions. So if your child lacks the capacity to make their personal decisions and you're applying for guardianship, we recommend also applying for trusteeship at the same time, because you can use the same Form 4 capacity assessment report to apply for both. So this slide really shows you the different areas of decision making. Personal decisions include things like healthcare, housing, schooling, employment, legal matters that are not related to finances, social activities, and friends and partners. So who your child is going to hang out with, what they're going to do, where they're going to live, what kind of legal contracts they can enter into, what decisions are being made related to their healthcare are all personal decisions. And that would require either co-decision making or guardianship if your child has some sort of limited capacity. Financial decisions, only way you could make financial decisions for your child is if they lack capacity to make their own decisions. And that would be the Form 4 capacity assessment report that is being completed for guardianship as well as trusteeship. So trusteeship is just the one little bubble on this slide. It's the financial. All the other ones are related to personal decisions. Personal decisions are those that have the supported decision-making, co-decision-making, and guardianship option. Alberta has 2 funding options for adults. They have assured income for the severely handicapped, also known as AISH. AISH provides a monthly living allowance as well as health benefits to those who have a condition that severely impacts their ability to earn a living. AISH also provides some personal benefits, which is money over and above the monthly living allowance for specific needs, such as a special diet or assistance in the event of an emergency. So they provide funding for staff. PDD, on the other hand, which is persons with developmental disabilities, they provide funding for staff, caregivers, or aides. And the amount of money that they provide is based on an individual support plan that is determined between the client and the family and their PDD case manager. Some of the things that they provide caregiver funding for would be home living supports. And that would be to help clients do daily activities like banking, taking care of their home, making meals, doing laundry, or respite supports that would give you as parents a break if your child's living with you full-time in the home. Community access supports is another thing that they fund, and that's to help their clients take part in activities where they can learn, develop, relax, have fun, or be with others. That might include things like going swimming, going to the mall, taking a post-secondary class through one of the inclusive post-secondary institutions, going to a music class, and having a caregiver or aide with them. The final thing that PDD provides support for is employment, and that's to help their clients learn new skills or find and keep a paid job. It's important to note that PDD does not provide a monthly income. They do not provide medical equipment, transportation, housing, medical care, or crisis or decision-making supports. The financial monthly income comes from AISH. PDD pays for staff. This slide is going to give you just a little bit of information about applying for PDD and AISH. I'm going to start with PDD because it's very important to apply for PDD at 16, given the length of time that it's currently taking to process applications and assign case managers. PDD also does not provide supports to those living on a reserve. PDD is funded by the provincial government. The expectation for those living on a reserve who have a developmental disability and need caregiving staff is that the federal government will provide those supports through the band. The criteria for being eligible for PDD is you have to have a developmental disability that is demonstrated through a recent psychological assessment whereby the full scale IQ is recorded as 70 or less. Now, usually when you have a psychological assessment, the person who's doing the assessment provides a range. So they give the full scale IQ, but then they give a 95% confidence interval that that person's IQ falls between a bottom number and a top number. And PDD will take the lowest number of the range. They don't look at necessarily at the median, which is the full scale IQ. They will take the bottom number of the range if it is 70 or less. You have to have a condition, your child has to have a condition that is onset before 18. And then there is an adaptive functioning inventory that PDD will go through with you as part of the intake process, that your child needs to require assistance in at least 6 of 24 adaptive skills area. So that's the criteria. You have to be diagnosed with an intellectual disability, which is a full-scale IQ of 70 or less. It has to be a condition that was onset before 18. So if someone has an accident that results in a brain injury after they're 18, they actually are not eligible for PDD. And you need to require assistance in 6 of 24 adaptive skills areas. AISH, you don't have to apply for it till your child is 17 and a half. If you've applied for PDD at 16, you will have a letter from them or will have been told that you are eligible for PDD prior to your child turning 17 and a half. And if you're eligible for PDD, you're automatically medically eligible for AISH. It's another reason to apply for PDD at 16. Because if you haven't been deemed eligible for PDD when you're applying for AISH, then you also need a medical form that's completed by a physician documenting severity and longevity of the condition so that they can deem you medically eligible for AISH. So if your child's going to need PDD, apply for that at 16 so that when your child is 17 and a half and they're applying for AISH, you don't have to have a medical form be completed by a physician. To be eligible for AISH, there are 3 eligibility criteria. One is proof of Alberta residency. So that's government issued photo ID with your Alberta address on it. For those who have driver's licenses, that would be sufficient. If your child is not able to get a driver's license, you can get an Alberta photo ID for them at any registry office. So they will need that to demonstrate that they are residents of Alberta when they apply for AISH. You also need a social insurance number for AISH and one other piece of ID. People usually use their Alberta healthcare card. You will also need to prove that you are a Canadian citizen or a permanent resident. Again, the PDD eligibility letter or a medical form B documenting the longevity and severity of the condition, so that they are aware that your child has a condition that's going to impact their ability to earn a living. And the final eligibility piece for AISH is that you have to be financially eligible. So they're going to look at recent bank and investment account statements. They are not looking at parents' bank and investment accounts. These are only your child's bank and investment account statements. So if your child doesn't have a bank account or any investments, they're going to be deemed financially eligible for AISH because they're only looking at your child's income, not yours. It's important to note that many teens have registered disability savings plans or registered education savings plans. These are considered their investment accounts. The registered education savings plan is considered an asset according to AISH. However, you can have $100,000 in assets and still be eligible for AISH. So unless your child's registered education savings plan, their RESP, has more than $100,000 in it, that shouldn't be a concern. Your teen may also have a registered disability savings plan, RDSP. That is also an asset, but it is an exempt asset. So it's not taken into account by AISH. However, they will still want to see and will want you to submit that investment account statement with your AISH application. Now we're going to look at some Alberta Health Services resources that can help you prepare for the transition to adult healthcare. The first one is a website that the Alberta Health Services Well on Your Way program has created. On that page, there is a button. When you go to that landing page, there is a button that says Getting Started, and it will take you to the Transition 101 page. That web page has all kinds of guidelines and checklists and resources that you might find useful. Within the website, there are also pages for youth that will help them get ready for medical independence, as well as pages related to decision-making supports like I've talked about, or applying for adult funding, as I've mentioned. So there are some really good pages on that website with generic information and links to specific resources that you will find helpful. The Well on Your Way program also offers workshops and consultation to help families as they prepare for the transition to adult care. This is one of the transition guidelines that is on the Well on Your Way website, that Transition 101 page that I talked about. And you can see that this is broken down into apply for, learn about, and prepare by, as well as broken down by ages 12 to 14, 14 to 16, 16 to 17, and 17 plus. It just gives you a rough idea of some of the things that you can be doing at each of those ages and stages to begin preparing for the transition. These guidelines were created by young adults and parents who had already transitioned to adult healthcare, and they were the ones who kind of set the timeline and told us the things that were important to know and do at that time. Embedded within the guidelines, you will see there's some blue writing. Those will take you to links on our webpage or outside of the Well on Your Way webpage with more information about how to actually accomplish that step. This slide is the transition guideline for youth who are going to continue to be dependent. So that's youth who will continue to need decision-making support as adults. The previous one was for youth who were going to be independent and have capacity to make their own decisions. This one is for youth who are going to continue to need decision-making support as an adult. So both are available on that Transition 101 page. In addition to the guidelines, we also have checklists. And these readiness checklists have kind of more in-depth steps that you might want to use to get ready. They include things like my child knows how to make an appointment. My child knows or carries a copy of their health condition. My child knows how to fill or refill prescriptions. The other one's a higher level, apply for or know about. This one actually breaks it down even further. And we have one for parents of youth who are going to be independent and making their own decisions, as well as one for parents of youth who are going to continue to be dependent. And you can find both of those on the Transition 101 page. At Alberta Children's Hospital, we offer workshops for teens as well as for their parents to help them prepare for the transition to adult healthcare. These workshops are peer facilitated. And so the one for teens is for those ages 14 to 19, and it's led entirely by young adults who've already transitioned to adult healthcare. And the focus of this workshop is to help teens know what they need to know about their medical condition, help them know what they need to know to be able to talk to their professional and their personal supports about their health condition, and to help them understand what they need to do in order to balance all the competing priorities in their life. The workshop is really geared for those who are going to have some capacity to manage their own health as an adult and advocate for themselves. Parent workshop, which is simultaneous when we do it in person or earlier in the day if we do it via Zoom. The primary purpose of the workshop is to support parents in their changing roles and to help them learn what their children are learning so they can continue to develop those skills, independent skills, at home over the next several years. Recognizing that a 3-week workshop, a couple of hours on a Saturday morning, is not going to prepare your child adequately for the transition to adult healthcare. It's a process that's going to take years to work towards. So the purpose of the parent workshop is to help parents learn what their teens are learning so they can continue to work on that skill development at home. In addition, we do have a panel of parents who come back and share their story. In one of the sessions, we have parents talk about, what their experience was and what they wish they had known. And it gives parents an opportunity to talk to parents who've been there and hear a little bit about their story and helps them understand some of the things that they might need to know. We also have an adolescent medicine community pediatrician come in and talk about adolescent brain development to help us understand a little bit about what's happening in your teens' brains. And when we know a little bit about what's happening in their brains, it also helps us know how to work better with them to develop the skills that they're going to need. This is cardiology-specific website that is related to the transition from pediatric to adult care. So it's helping those with cardiac conditions, congenital heart disease, move to adult care. It's iHeart Change, and it is an excellent resource. It's got all kinds of specific information to help those with congenital heart disease prepare for the transition from pediatric to adult care. I'm sure that you have questions as you think about your child's transition to adulthood. And my contact information is on this very last slide. You can email me at wellonyourway@ahs.ca or call me at 403-955-7252, and I would be happy to answer any questions you have. Thank you for your time. Thank you for listening.
Thank you for joining us. If you want to learn more about neurodevelopment and mental health and congenital heart disease, please subscribe to our YouTube channel and follow us on Instagram. We are called Strong Hearts, Growing Minds. In the post section of the YouTube channel, you can also find handouts on various topics, while our Instagram account will keep you updated on new upcoming workshops.